Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on the program.
Yes, sir. We crossed a huge milestone, and I just wanted to ask you a little bit about that, and then have we been making inroads in the 18 to 40 age group, because I know that was a major concern.
Well, as of yesterday, more people have been coming out to get their vaccines. And so, as of yesterday, we have 203,847 persons with their first dose. So there has been a little increase. We are now at 41.9% of our adult population receiving the first dose. And in terms of second dose, we have 70,778 persons who are now fully immunized. That represents 14.5% of our adult population.
Yes. All right. We had spoken recently about this particular age group. Have they been responding? I know that the teams are on the ground and they're encouraging.
We have been working in terms of getting more people vaccinated, and in terms of the age categories that we're looking at, 60 persons 60 years and above, we now have about 70.5% of those persons receiving their vaccines. That is the first dose, at least. They have 70.5% of persons have received their first dose, and this is for persons 60 years and above. For 40 to 59 years, we have right now 38.3% of that age group receiving their first dose. And for persons 18 to 39 years, we have 33.7% receiving their first dose. So the numbers are going up, but we still have a lot of work to do.
Of course. I know right now the teams would have to deal with the flooding across the various regions. I wanted to ask you about how much and if it had hindered them in any particular way, and how are they managing on the ground?
Well, I mean, in some of the regions, there are particular areas that have been flooded. So in those areas, obviously, we're not able to do vaccination. But we do have fixed sites that continue to work in every region, and we are still pushing some of the mobile sites to get out and get people vaccinated. So those centers are working. Most of them have not been affected by the flooding. In Region 9, however, there are significant areas that have been flooded, and those areas we have been affected. And so in some of the interior locations, like in 8 and 7, the medical team has more or less switched to observe basically what's going on with the flooding and to bring medical relief if it's necessary.
All right. In terms of persons who are staying in the shelters, I just wanted to ask you, I know that the CDC is basically taking the lead to do that, but in terms of COVID-19 measures, what?
We have had, since the rains have started, we have had discussions with CDC. We have provided them with appropriate guidance in terms of what they need to observe to prevent COVID-19 in shelters. And so wherever they're establishing shelters, they're making sure that these protocols are adhered to. Because what we don't want is that you bring people, put them in a relatively enclosed environment, and if someone is sick, then with COVID, then they can infect all others in the environment. So we want to prevent that, and that's why we are taking these precautions.
All right, sir. Not to take away from COVID itself, but I know that one of the things that you've had to deal with since coming into office was the shortage of medication across the board. But I know that the government has been purchasing and so on. Right now we're dealing with the floods and, of course, the possible outbreak of waterborne diseases. What assurances can you give us that, the ministry is on top of that?
Well, in terms of medication, as I've said before, we are trying to make sure that we reduce the shortages. And I think right now we have almost all the things that we need. And we have been bringing them into the country and then getting them out to the various regions. So that's an ongoing process. Dealing specifically with waterborne illnesses, one of the things that we have to look out for in children is diarrheal diseases. And so our teams have been observing to see whether or not we'll see spikes in diarrheal diseases. So far, we haven't seen in any region that there have been spikes. But nevertheless, we have oral rehydration salts in all the regions. We have distributed them to the different health centers. So just in case if we have any spikes, there would be ORS available to the health workers so that they can give them out. In addition to that, we have distributed bleach. Bleach can be used with water to make sure that you purify the water to decontaminate. So any bacteria in the water will be able to reduce the amount of bacteria in water by adding bleach to it. So that has been an ongoing exercise. Every region, we're told to collect bleach from the MMU. Most of them have already done so, and so they're now using that to distribute it into the flooded areas so that people can have safe water. In addition to the bleach in the water, what we have advised people, and in all the regions the health teams are doing that, is to boil their water, just to make sure that they're safe. Boil the water that you're drinking, and that would keep it safe from bacteria and preventing you from getting infected. We have noticed now that in some areas the water have receded a little bit, that a few areas people are complaining of skin rashes, and again we have our teams have been out there and we have been distributing creams and ointments to reduce those rashes. So that's the only thing that we have seen in a few areas, but it's not a large amount of people. It's just a few people that we would have seen with that. So far, I know when people talk about flood in Guyana, that has become associated with leptospirosis. So far, we haven't seen any case of leptospirosis, but again, the teams are being vigilant and observing for these things.
All right, thank you. What about the safety of the health workers that are out there right now? I know this is something you also emphasize and re-emphasize repeatedly.
Yes, I mean, the health workers are taking all the necessary precautions. So not because it's raining we don't have to wear masks. We still have to wear masks because once you're coming in contact with people, you need to mask up and use all the PPEs to protect yourself against COVID.
All right, as we're on PPEs, I know yesterday the ministry would have received a huge amount of equipment and so on through PAHO, but I know this is an ongoing initiative. Just a little bit on that.
So between the Canadians, that's a bilateral arrangement. They have been able to donate PPEs and other supplies worth $178,000. And the World Bank would have given us a grant of about $1 million. So these sums of money were managed by PAHO to procure things such as PPEs and oxygen concentrators and things like that to make sure that we have enough of these things. And so from September last year to now, those grants were in the execution phase, and yesterday we got the final set of supplies, so we'll start closing off those grants because we would have exhausted the funds. The World Bank has indicated to us that they'll be giving us another grant, and so we'll be negotiating to make sure that we get that grant in a timely manner.
Okay, thank you, sir. One last question before I go, and it slipped me to ask you earlier. I know one of the regions that you've had repeated challenges with was Region 10. I just wanted to find out how, in terms of vaccination, how that has been going.
Region 10 continues to be an outlier in terms of not getting enough people vaccinated. So we still have Region 10 lagging. They're just a little bit above 12%, whereas the national average is closer to mid-40s. And that's for the first dose vaccines. So there's still a long way to go with Region 10. And, we have to keep pressing and continuing the work there.
All right. Well, thank you so much, Mr. Anthony, for speaking with us.
Thank you.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.